Welcome to another episode of the Nuclear Medicine Molecular Medicine podcast, and we're here at the Society of Nuclear Medicine meeting in New Orleans. And this is the 20th year we've been doing this podcast, so it's the longest running medical podcast in the world. And talking about someone who's been doing stuff for a long time, Severos, I've known him for a very long time, and he's been doing work promoting nuclear medicine worldwide. And I mean, when I mean worldwide, I really mean worldwide, right? So tell us a little bit about where you are now, although you've been in Cyprus pretty much forever anyway. But...
Yes, I am in Cyprus. I am a nuclear medicine specialist there, but as you said, I am traveling around the world promoting nuclear medicine. I am currently the president of the World Federation of Nuclear Medicine and Biology since 1st of January 2026 actually. And I will finish 25, and I will finish my term next year, end of next year. It's 2 years term. And
perhaps tell us a little bit about what the World Federation of Nuclear Medicine and Biology is.
This is a good question, because many people, they don't know
yes.
our major capacity. We represent society around the world. That our members are not individual, but they are society, country society. This is national societies of nuclear medicine. And we have in the executive board all the continent represent. That means AOCNMB, EANM, African Society, ALASPIM from South America. We have Asian, Oceania, we have the Australian Society. All the countries, all the continents are represented in the executive board of the World Federation of Nuclear Medicine and Biology. The story started in 1970,
right,
when we established, or they established, the World Federation. And since then, we organize every 4 years also World Congresses.
Right, and you also represent nuclear medicine to the World Health Organization, right?
This is one important, we are, they call it non-state actors. Why they call non-state is because the World Health Organization has member states and their countries.
Right.
And over and above of these countries, they have 74 non-state actors. But the important position of the World Federation is that we are the only that represent nuclear medicine and the interests of nuclear medicine in the World Health Organization. Right. A very important position.
Right, so correct me if I'm wrong here, but they do have non-state actors that do other things. For example, the Red Cross and Red Crescent Society is represented in a lot of the United Nations bodies as a non-state actor. So,
yes.
But for nuclear medicine, the World Federation of Nuclear Medicine and Biology is the...
For nuclear medicine, we are the only one, and it's also International Society of Radiology, for example, for radiology, and they have also other medicine specialty as non-state actors.
Right, so tell us a little bit about this upcoming meeting. It's in February next year?
You mean the World Congress? The World Congress will be in Cartagena.
Yes.
We establish also a series of meetings during 2025.
Right.
We call it Road to Cartagena.
Right.
Actually, it's not a new idea because we had a road to Kyoto for
right.
2022 when the World Congress was in Japan.
Yes.
And we started in Algiers with a seminar there.
Yes.
And then we continue around the world. It was a very interesting road. We went to Singapore, we went to Athens, we went to Australia, here in AOCNMB, and the last stop will be in Cyprus. And the ultimate destination is Cartagena. Why Cartagena? Is because it's the place that we host the 14th World Congress of Nuclear Medicine and Biology. is between 13 and 18 of February, if I am not
Yes,
wrong.
I think that's about right, yeah.
It's 13 to 16.
16, right.
But they can stay for post-Congress till
They
18th.
can. And
It's not a problem.
pre-Congress as well, right?
Pre-Congress, yes.
Right, so Cartagena is a very historic city.
Yes.
Latin America's got a huge population and a large number of nuclear medicine facilities. There was a previous World Federation meeting which I went to in Santiago in Chile.
Exactly, 2002.
Yes.
And there was also at the beginning, I don't remember exactly the year, in Buenos Aires in Argentina.
Yes.
This is important meetings. The impact of the World Congress in one country is amazing, actually, because we are nuclear medicine. When we are between us, we think that everybody knows nuclear medicine. We are the best, we are okay, everything is good. But if you go a little bit outside, we are not so well known.
Yes.
And this is a pity.
Right.
That means it's a matter that we have to improve. We have to make it better. And one opportunity is to organize the World Congress, because specialists for around the world are meeting there. The media are interested in a World Congress, and also the authorities are also interested about nuclear medicine. And I think it's a very good boost for the country.
Right, and it's once every 4 years, so it's a big meeting. It means that you're going to get all the people that you might see at a European or American meeting, but in many ways it's more easier to get there, easier to get visas and things like this, easier to lower costs, and it also means that particularly those, for example, this time around, are going to have more things in Spanish language, for example, or Portuguese, so that they can get some more local content as well.
I have to say it's a different meeting.
Yes.
It's not a SNMMI meeting, it's not EANM meeting.
Yes.
It's more a family meeting.
Yes.
I tell this very conscious about this, because it's a family meeting, we meet together. It's a different meeting in the matter that people of many countries are contribute, and not only what we call high scientific achievement will be presented, but also the everyday job of people which also contribute in nuclear medicine. Please think about it that most of nuclear medicine is not PET-CT, is not theragnostic, is the old good-fashioned SPECT and SPECT-CT. And this will be also promoted in this World Congress.
Right, and it's also how to improve those and design them for places that haven't got high income. So, I mean, one good example of that would be, for example, technician PSMA SPECT, right?
Yes.
Which you're not going to see in Western countries. Well, not all. Some Western countries. It's being done in New Zealand, but
New Zealand is not so west. But
but,
if we are
right. But it's being done in Zaire, right? And,
yes.
And done to a lot of nuclear medicine, if you do it right, if you do it tailored, is actually far more cost effective than traditional medicine. If you're going to take up, and even theranostics in some ways, so if you're going to do radiotherapy or chemotherapy, then you've got to have intensive care units, you've got to have deal with people who are immunocompromised and all that sort of thing, which is very expensive and very difficult to do in hospitals situations that might not have a lot of those facilities. But a theranostic prostate therapy, it's fairly simple.
I have to tell you something. Innovation is coming from a need.
Yes.
And these needs are not in the established departments. Because in the established department is very easy. You pick up your phone, you make a phone, I have this problem, please solve it. You call a company, you call somebody outside.
Yeah.
If you are in a low-income country, you have to find a solution within the department. and then you have to work in whatever you have. This is why they have the technetium PSMA,
Yes.
because they had only SPECT CT and not a PET CT. And the question was how we treat our patient.
Yes.
How we treat our patient. And then they say, okay, let's try with technetium. We have technetium, we have PSMA, put it together and let's see what happens. Okay, the quality of the images was not the best like PET CT, but it was important to know that there's a PSMA uptake to the patient and easy to give the therapy.
Yes.
I repeat once again, innovation is coming from a need, and the department that they have the needs are department in low income countries.
Right. And I mean, another example is looking forward, how you can tailor what you do for low income countries. For example, we're talking about amyloid therapies now that are coming out for Alzheimer's disease, but they're $40,000, $50,000 a year, even at non-USA prices, right? This is prices that might even be in India or in Australia. But the next therapy we should think about is a vaccine, right?
Yes.
That can do the same sort of thing, but do it at a much lower cost. But you'll still need to image. You'll still need to improve on those blood tests for stopping so that it's not so expensive. And you've got to think about tailoring what you do to what's affordable in the country. And that requires special innovation of all its own. And you can have a big impact on medicine in that way as well.
Yes, this is the important thing, innovation, and also to adapt the situation in the country. Most of the guidelines that are coming out from, it's not a critic, we need the guidelines, but most of the guidelines are coming from USA and Europe, are based in the knowledges of high departments that they have everything.
Yes.
Okay? And this should be adapted in department they have almost nothing. Because what is our scope? To heal the patient. If the patient's in the middle of our interest, this is very important. And we have to use whatever we have for the best interest of patient.
Couldn't agree more. And I mean, that's what it's about. It's about, you can go for the very best, but if you can't afford it, you're not going to get it.
Exactly.
And so you need to go for what you can afford and what can be rolled out in large numbers. And if we think about that, they're the things that have always made the biggest impact in healthcare anyway. Improving the water supply, right? That had a huge impact in healthcare. Bringing in smallpox vaccine, bringing in polio vaccines. Those are the kinds of things that have made a big difference and have been very affordable, right? The same thing we can do. If we're going to think about treating Alzheimer's disease, we'll think about a vaccine that can be rolled out cheaply. If we're going to think about cancer, theranostics is a lot cheaper than chemotherapy.
Yes, exactly. Not only cheaper, it's easier.
Yes.
It's easier than chemotherapy.
Yes.
And this is also very important. It's an easy task. You have to know how to deal for it, but it's an easy task. It's not so complicated.
Right. And also you might want to do it differently. You might want to have less surgery for cancer. And if you can, in early cancer, if you can replace it with a theranostics rather than surgery, where you don't have the concurrent risks and expensive surgery, infection, and all those sorts of things, then that may be a more appropriate task in selected patients, in the right patient.
Yes, okay, this is a must. But I have to admit that we have to invest more in education.
Yes.
We have to have nuclear medicine specialists in a very high standard.
Yes.
We are not anymore scan readers.
No.
Forget it.
Well,
scan reader is not anymore.
Right. Computers can do that very well anyway.
Yes,
We've got
yes.
AI to do that.
But I think we are clinicians.
Right.
We have to know the disease from A to Z. We have to know the side effects. We have to know also other therapies.
Yes.
Not the competition, it's other therapies.
To complement.
Exactly, to
The blood test that you need to do. Yeah.
what is happening. And I think education is a must in nuclear medicine.
It's not just for the physicians.
Everybody.
For everybody. We need technologists in Africa, there's a desperate shortage of there's a desperate shortage of technologists everywhere. But one of the things that can work and does work and shows work in Outback Australia, for example, is advanced practice nurses who can work people up for in Outback Australia, work them up for neuroendocrine therapy. You can get advanced practice technologists who can do a lot more than just press a button to start a scan. They can also do a lot of quality control on the cameras, do a lot of physics. Those are the kinds of things with training people in the world. You may not have many physicists in Africa or anything, but you can train a technologist up to do an excellent job.
I have to tell you something. We introduced PSMA in my country in April 24, after it was approval from the European medical authorities.
Yes.
Without my technologies, I will not be able to do the therapy. Yes. And I trust them.
Yes.
And this is very important. They do the whole job. And what I'm doing, I'm just inject.
Yeah.
We select the patient. We know the problem of the patient. But without the technologies, none of these therapies could be done. And that's important. And thank you for mentioning it. Nuclear medicine specialists, sometimes we have all the facilities to educate them. We can send in seminars, we do this, and this. For technologies, the opportunities are less, and we have to create opportunities for them.
I agree. And I think the other thing is, if you think about this as a restaurant, what's the most important thing in a restaurant? It's not the food critic who eats the food and writes a report about it. It's actually the chef.
Yes, right. Exactly. Who is produced it?
Right. And obviously the farmer is also important, so the pharmacy is important. But actually, if you think about it, the food critic is not the most important person in a restaurant. And I think perhaps in a nuclear medicine department, the person who reads the scan may not be the most important. I think often the skills that are involved in that, and they need to be valued, they need to be appreciated, and they need the opportunity to travel, to learn, to do those kinds of things as well, not just the physician.
We have another one problem with technologies, is the language barrier.
Right.
Okay. You are living in Australia, yes, where everybody is speaking English.
Well,
or they try to.
Well,
I am living in Cyprus, where most of the people, they speak English, but in most of the African countries, but even in Latin America, the technologies, they don't speak English, yes, enough, yes, that they get the education. That's why we need also to translate things in their native language, sure, to understand what they are doing.
Well, I do come from Melbourne, which is the third largest Greek-speaking city in the world.
But you don't speak Greek.
I don't speak Greek. Yeah, yes, but you know, I think it's important that this area is very much recognised, and I think that sometimes it's missing out. If there's funds to travel, pay for people to travel or get educated, it's often spent just on the physician, whereas really we should be thinking about nurses and technologists and other people who can make those kinds of things happen. Yeah.
One very good initiative is they call Teach the Teachers.
Yes.
Okay. And this is also an initiative from the International Atomic Energy Agency. You select some important people from the point of view that they are good in what they are doing. You teach them, and they act as teacher for the rest of the people.
Yeah, sure.
And teach the teacher is very, very important, especially when we are going for technologies and going also for nurses. Yeah. Because think about it, you have a good person from Brazil, speak good English, and then he educated and go back and put everything in Portuguese for the rest of the technologies. And I think this initiative, Teacher the Teacher, is very important.
And we shouldn't forget about other countries that miss out. Australia is a very rich country, but a few hundred miles from Australia is the Solomon Islands and Papua New Guinea, right, and Fiji, right? And all of these places have very few, if any, facilities in nuclear medicine. And sometimes we forget about the people who are right next door, who we should be helping and we should be educating and we should be getting up, because nuclear medicine is uniquely placed to actually provide cost-effective care if you tailor it correctly.
Yes, exactly. This is the important word, tailoring for the patient.
Thank you very much. Anything else you'd like to add?
No, thank you. Okay. Thank you for giving me this opportunity. Yeah. I think promoting nuclear medicine is a very important task, and I do this with pleasure.
Yes.
And thank you for giving me the opportunity to talk to your audience.
Yeah, thank you, Jonas. Hi, I'm here in New Orleans, as you can tell from the great background of the music here, and I'm really enjoying the meeting. But one of the problems is that the audio and video in the next part's really quite bad. So I'm not even sure you'll be able to make out what was said. But what we really were talking about was the Asia and Oceania Congress of Nuclear Medicine Biology and the annual conference of the Society of Nuclear Medicine in India. And they're quite big meetings. There's a lot of participants in India alone. There's over 600 nuclear medicine departments in India. And the Asia and Oceania Congress is really very much a very rapidly growing part of the world's nuclear medicine congress. So we've got people from Australia, from Thailand, from India, and so on. So there's a lot of different people. There's going to be a lot of very interesting talks, and a lot of the interesting work that's been done, particularly in this part of the world, was pioneering. Some of the first places to really adopt theranostics in a widespread way were actually India, rather than even Australia or Europe or the USA. So the meeting's going to be held in Chennai, which is one of the most beautiful cities anywhere. And there's a lot of very interesting places near there that are great to visit. There's the lakes in Kerala and so on. So an excellent place. So if you can make it there, please do. I will include the invitation, but the audio is quite bad.
I will start. I am Dr. Akram Ibrahim from Jordan. Yes. I am the president of the Oceania Federation of Nuclear Medicine and Biology. And I would like to take this chance of participation in the annual meeting of the AOCNMB in New Orleans to invite our nuclear medicine colleagues participating in this prestigious conference, also to attend the Oceania Federation of Nuclear Medicine and Biology, which will be held in Chennai, in India, in this December, from 4th to 7th December. This Congress promises to have more than 1,000 participants from India and from the Oceania. Also, we are anticipating participation from the international organizations like AOCNMB, IEA, ENM, among others. And we will have, this Congress will cover the most advanced theranostic applications and how to increase access to nuclear medicine and theranostic services in Oceania and beyond. And my colleague will talk more about the details of the medicine here.
Thank you, Dr. Akram. Myself, Dr. Santosh. I am the organizing secretary of this AOCNMB 17th Congress. I thank the AOCNMB to give the opportunity to the Asian subcontinent, that is our country, India. Unfortunately, my president, my chairman, Dr. Prabhu, is not here physically, so I will extend the invitation on behalf of him to attend this conference. And we have a very deep-rooted history and legacy, our country. The oldest language spoken, Tamil, is there, and we welcome everyone to enjoy the hospitality of the city, which is having the second largest beach, that is the Marina Beach. And in addition, this academic should be extremely great. We are doing of the highest numbers of diagnostics general nuclear medicine, and even interventions like peg-guided biopsy in our country. So that's wonderful to learn from our platform. So I extend this invitation to each and every nuclear medicine physicists, technologists, and doctors, scientists around the world to come and enjoy and experience and learn more. Thank you.